Hello, Dr. Jha.
Yes. Hey, how are you?
Very well. How are you doing, sir?
Good. I was just, my previous call was just running late, so I
that's
apologize.
Fine. Very well.
Apologize. Hey, so thanks for connecting up and thanks for asking the question that you did.
Oh, well, they're vital questions, and they really needed to be asked right now. And so I thank you for, in this busy time, of taking a little bit of time to follow up so that we can put this together as a piece. And I've got a few questions to ask you. I've written them all down, and so we'll go right through it.
That sounds great.
Great.
I'm ready.
Today I'm speaking with Dr. Let me just make sure the recorder's on. It is. Good. Today I'm speaking with Dr. Ashish Jha, director of Harvard's Global Health Institute, who has been on the front lines facing the novel coronavirus pandemic and providing medical providers, hospitals, and local, state, and world leaders with crucial solutions in how to deal with this crisis. Welcome, Dr. Jha.
Thank you for having me.
I want to begin by referencing a question I asked President Donald Trump on Wednesday.
Dr. Ashish Jha, who's the head of Harvard's Global Health Institute, says that the key to getting this economy open as soon as possible is to test everyone who needs testing so we can quarantine all infected individuals and allow everyone else to go back to work immediately. Would you subscribe to that strategy?
No, but we have tested more than anybody. I saw him. I saw his statement. We have tested by far more than anybody. We're testing more than anybody right now. There's nobody even close. And our tests are the best tests. They're the most accurate tests. But if you're saying we're going to test 350 million people, I watched his statement. I disagree with it. We can go to certain states. I could name them now, but I'm not going to do that. But we can go to certain states right now that have virtually no problem or a very small problem. We don't have to test the entire state in the Middle West or wherever they may be. We don't have to test the entire state. I think it's ridiculous. We don't have to do it. A lot of those states could go back right now, and they probably will, because at some point in the not too distant future, certain states are going to come off the rolls. Maybe New York can't, and maybe California can't. Maybe the state of Washington can't, although if you look at them, their biggest problem was in one nursing home. Yeah, go ahead.
But the states aren't siloed. And so, I mean, if you test one state and then the person moves over to the other state, well then...
Well, you're going to just look at that. But if you take a look at the states, and many states that I'm talking about, they don't have a problem. We have some big problems, but it's confined to certain areas, high-density areas. So why would we test the entire nation, 350 people?
President Trump indicated that you are advocating for 330 million people to be tested. Is that what you meant?
No, not at all. Look, I said, I've always been very clear that we need to be able to test everyone who needs to be tested. Of course, that begs the question, who needs to be tested? We need to be able to test people who have symptoms. We need to be able to test people who've had contacts with people who've been infected. We need to be able to test healthcare workers. And then we need to do a sample of people in the community who don't have symptoms, because we know that there is asymptomatic infection and spread happening across America.
With that being said, I'm going to say it again. We tested far more than anybody else. We have the ability to test. I mean, we've come a long way from an obsolete, broken system that I inherited. We have now tested with the best test far more than anybody else. And when I say anybody else, I'm talking about other countries. No country is even close. They came out with a statistic, yesterday that I heard from Dr. Birx, where it's for eight days here, more than 8 weeks in South Korea. And South Korea's done a good job. But we did in 8 days more than South Korea did in 8 weeks. That's a big number. And we're getting, I said before, exponentially better. Every day it's going up substantially. We have an incredible apparatus built now. But no, I don't want to test 350 million people.
President Trump says that U.S. testing is now higher than South Korea and China. Is this good news?
So, first of all, it isn't per capita, right? Because, look, we're a much bigger country than South Korea. We're about 6 times bigger than South Korea. So, of course, we're going to have more tests than South Korea. But per capita, we're just starting to catch up to South Korea. It is good news. Like, testing is clearly a good news in the sense that we've gone from abysmal to not quite adequate, but not terrible. But we need to do more. We just need to catch up. And the part of the reason we can't just look to South Korea levels is that South Korea was testing at a time when they had far less infection outbreak, far less spread in their community than we have. The way to think about it is, if you have a little outbreak, you need a certain number of tests. If you have a huge outbreak, you just need a lot more tests to capture everybody. And we have a much, much bigger outbreak per population now than South Korea had. And that's why we need to really have a much more extensive testing framework than even South Korea needed to do at its height.
The pandemic appears to present itself both as a health crisis and as well as an economic catastrophe. President Trump recently beefed up his financial team by bringing back Kevin Hassett, former chairman of the White House Council of Economic Advisors, and Joe Lavarna, a veteran Wall Street economist, to assist the National Economic Council, or NEC, to navigate the rocky financial terrain that COVID-19 presents. Is President Trump right to focus on the economic vicissitudes first?
Look, the economic costs of this disease are obviously very, very large, and they have huge effects on people's lives. And so I'm sympathetic to the idea that we need to have an economic focus. However, what I hear from all the economists, and I'm obviously not one, what I hear from most economists is, if you want to get the economy back on track, you want to help the economy, deal with the virus, because the virus is what is causing the economy to shut down. And so focusing first on the economy is literally focusing on the symptom, not focusing on the cause. And one of the first things you learn in medical school is focusing on the symptom doesn't cure the disease. You got to deal with the underlying cause. The underlying cause here is the virus.
Bottom line, given your decades of experience as a medical doctor, as well as an MPH and public health expert, in a nutshell, what is your plan, and what are the consequences of focusing on the financial element of this first, while merely continuing our present patchwork approach with 50 different plans run by governors of each state instead of an overarching united approach led by the federal government?
Yeah. So look, most public health experts, I think, are on the same page about what we need to do. And this is not rocket science. First, we need a national pause, because when some states are paused and other states are not, people are traveling from one state to another. We're not doing a good enough job of really slowing down the spread. So we really need to slow down the spread. Second is, we're making progress on testing. We got to dramatically increase testing. And really know how much disease there is, how quickly it's spreading, what the broad landscape looks like. At that point, we can open up parts of America. We can open up communities where disease burden is low, where spread is small, and where we have good testing infrastructure in place. I think in those places, you can have people go back to work, and that will help the economy. And then you need to make sure that as you're testing, as people get identified with the disease, you need to quarantine them. You need to separate them so they don't spread the disease to others. That is the obvious strategy. Every public health person knows it. The truth is, if we implement that strategy, we'll get our economy back to work. We'll get people back to work. If we don't implement that strategy and let every state try to figure this out on their own, you're going to get each state's efforts are going to be less effective because people travel across states. And we are going to keep harming our economy for weeks and weeks and months because we're going to have flares, we're going to have shutdowns. It's going to be much harder and much more painful. So the question is, do we want to take our medicine up front, or do we want to kind of drag this out all through the spring and summer and fall? Personally, I'd like to take the medicine up front, do it once, and then move on.
As a final question, realistically, how long do you think we will be in a lockdown at a minimum if your plan were to be adopted?
So this is, if my plan was to be implemented or ignored? I'm sorry.
To be implemented, yes.
To be implemented. Yeah, so look, people disagree on this. A lot of experts disagree. I've heard a lot of experts say that they think we need to be on lockdown for 8 weeks. Others say may not be quite as long. I don't think it's 8 weeks. I don't know is the right answer, because I want to make that decision based on data. And if we go on a national pause, national shutdown, and we put all of our time and effort and energy into building a really fabulous testing infrastructure where we're testing everybody who needs it, being able to sample people in the community, that data will tell us when we're ready to open up again and which communities are ready to open up again. It's a completely reasonable way to do it. And it might be that in a couple of weeks, we might find that some communities are ready to open because they don't have much disease, there's not much spread, and there's good testing infrastructure. It might be that other communities, I can imagine New York, for instance, may be a bunch longer because they have so much disease in that community. And until that really turns around and starts dropping, it may not be feasible to open up New York again. So it will depend from community to community, but it should be driven by the facts on the ground, not by some artificial timeline that we'd all love to have.
So with this, your plan could actually get people back to work in a few weeks. Without this plan, we could be going months or many months or into the fall.
Yeah, I think without a concerted approach, what will happen is you might open up early, you get people back to work, disease spikes, hospitals get filled up, doctors and nurses start getting sick, hospitals essentially go in, your hospital system collapses, and your economy gets into big trouble. And then the only answer is to shut down again. And that shutdown is much, much longer and much more painful, and many more people die. I don't see any way around this because this is not about what I wish for. This is about what the virus will do. And without an aggressive approach up front, the virus is going to win every time. And so the question is, do you want to do a lockdown now, do it for a while, 2 to 4 weeks, and then create a strategy for opening up? Or do you want to be doing open, shut, open, shut, open, shut for months and months and months, much more suffering, much more economic damage? Those are the choices that political leaders have now.
Dr. Jha, thank you so much for your insights today. These are so needed in this time of crisis and hardship for many people throughout the world. And I hope that your knowledge gets to the right people here so that we can see a terminus to this.
Thank you very much for reaching out to me. I'm happy to do it.
Thank you.
All right.